Most people have no idea that pancreatic cancer is now one of the deadliest cancers among older adults, quietly killing more people each year than breast or prostate cancer. Even more alarming, over 80% of early warning signs are completely ignored, often mistaken for age-related fatigue, digestion, or back pain. And by the time these symptoms are finally recognized, it's often too late. If you're over 60 or love someone who is, this is something you can't afford to miss. Doctors now call pancreatic cancer the silent killer for a reason. With a 5-year survival rate hovering around just 12%, early detection is your only chance. According to research from Johns Hopkins and Mayo Clinic, 3 symptoms appearing together can boost early detection by nearly 70%. Yet, despite this, pancreatic cancer still flies under the radar, especially in seniors due to vague everyday symptoms like bloating, fatigue, or even dark-colored urine. That's why in today's video, we're going to reveal 8 overlooked symptoms of pancreatic cancer that could be your body's early warning system. You'll discover what to look for, why it matters, and how recognizing these signs early could lead to better treatment and higher survival. Plus, we'll explain how natural medicine is now being used alongside standard treatments to support senior health care in safer, more holistic ways. If you care about your long-term health or someone you love, pay close attention to these signs. Comment "Stay aware" below if you believe awareness saves lives. And don't forget to subscribe for weekly health tips that every senior should know. Symptom 1. Digestive problems. For seniors, digestive discomfort often gets brushed off as a normal part of aging. But persistent nausea, bloating, or greasy stools could be your body's early cry for help. Ignoring these signs may delay a critical diagnosis when time matters most. Researchers at Columbia University found that impaired digestion was the first visible symptom in 56% of early-stage pancreatic cancer cases, appearing 3 to 6 months before diagnosis. The pancreas plays a key role in breaking down food. When tumors form, enzyme production drops and fats remain undigested, causing pale, foul-smelling stools and loss of appetite. The American Cancer Society emphasizes these as urgent signs for seniors. If you notice lingering nausea or full stomach sensations after small meals, keep a daily food symptom log for 5 to 7 days. Track bowel movements, floating greasy or clay-colored stools should raise concern. Incorporate low-fat, easy-to-digest meals like steamed veggies, rice, and lean protein. Avoid heavy dairy or fried foods during this period. Seniors with dentures should chew food thoroughly to support enzyme absorption. If symptoms persist beyond 1 week, request a pancreatic enzyme test and abdominal scan from your physician. Evelyn, a 68-year-old retired nurse, noticed she was skipping meals due to bloating. Within a month of journaling her symptoms and speaking to her doctor, a scan revealed a stage 1 tumor. Early treatment helped her recover fully. Anyone on diabetes medication or with a history of gallbladder issues should consult a doctor before changing diet. If you have trouble swallowing or experience unexplained vomiting, skip self-treatment and seek immediate care. Symptom 2. Fatigue or physical weakness. Feeling tired after a long day is normal, but if you're over 60 and experiencing a deep, lasting fatigue even after full rest, this could signal something more serious. Seniors often overlook this type of exhaustion, mistaking it for aging or stress when it may be your body's early warning. A study from the National Cancer Institute revealed that chronic fatigue was present in over 45% of pancreatic cancer patients before diagnosis. Cancer cells drain the body's energy by hijacking nutrients meant for healthy cells. This results in decreased strength, poor stamina, and increased muscle breakdown, especially concerning for seniors who already face age-related muscle loss. If you feel worn down even after sleeping well, Begin tracking your energy levels on a scale from 1 to 10 twice a day. Note when fatigue peaks and how long it lasts. Try eating small, protein-rich snacks like hard-boiled eggs, Greek yogurt, or nut butter every 3 hours. Add 10 minutes of gentle movement like stretching or a short walk to help maintain circulation. Avoid sugary pick-me-ups which can crash your energy. Ronald, a 72-year-old grandfather, noticed he needed a nap by mid-morning every day. He documented his symptoms, added light walks after breakfast, and flagged the pattern with his doctor. A follow-up test led to early detection of a pancreatic mass and timely treatment. Anyone with heart conditions or chronic fatigue syndrome should speak to their doctor before adjusting activity or diet. If fatigue worsens suddenly or includes weight loss or breathlessness, seek immediate medical attention. Symptom 3. Fever and shivering. Occasional chills or mild fevers are common with age, but if you're over 60 and experiencing recurrent unexplained temperature swings, it might be more than just a passing virus. Seniors often attribute these episodes to just getting older, yet they may signal something much more serious. According to the Cleveland Clinic, intermittent fevers and chills were observed in 38% of pancreatic cancer patients within 6 months before diagnosis. These are caused by inflammation triggered by the tumor itself or by a blocked bile duct. This inflammatory process confuses the body's immune response, creating on and off fever episodes that don't follow the normal flu pattern. To monitor this, check your temperature twice daily, once in the morning and once at night for a week. Log any readings above 100.4 degrees Fahrenheit or 38 degrees Celsius. If chills occur without cold exposure or you wake up drenched in sweat, make note. Drink plenty of fluids and avoid over-medicating with fever reducers unless advised by a doctor. If you also notice yellowing of the eyes or skin, bring this to your physician's attention immediately. Margaret, a 74-year-old piano teacher, dismissed her cold shivers as menopause flashbacks. But when her nighttime fevers returned 4 times in 2 weeks, she sought help. Tests revealed an obstructed bile duct and an early-stage pancreatic tumor. She began treatment while still in stage 1. Seniors with autoimmune disorders or on steroid medications should speak with their doctor before taking action. If fever is accompanied by chest pain, confusion, or fainting, seek emergency care without delay. Symptom 4. Blood clots. For many older adults, leg swelling or tenderness might seem like a minor issue. But sudden, unexplained swelling, especially in just one leg, could be a sign of something more serious, a hidden blood clot. Seniors are particularly vulnerable, and overlooking this may lead to life-threatening complications. A study from the University of Michigan Medical School found that pancreatic cancer increases the risk of deep vein thrombosis by nearly 20 times. The cancer produces substances that trigger the body's clotting response, especially in the lower limbs. These clots may cause warmth, redness, and pain, and if they travel to the lungs, they can cause pulmonary embolism, a sudden and fatal condition. To protect yourself, check for one-sided swelling or discoloration in your legs daily, especially after long periods of sitting. If you feel a cramp-like pain or warmth in the calf, elevate the leg and note the time it started. Stay active by walking for 5 to 10 minutes every hour during the day. Avoid sitting with legs crossed and stay hydrated to keep circulation healthy. George, a 70-year-old gardener, thought his swollen calf was due to overwork. When it worsened after a flight, his wife insisted he get checked. A quick ultrasound confirmed a clot. Further testing revealed a tumor pressing near a major vein. Early diagnosis prevented a more dangerous embolism. If you're on blood thinners, have heart disease, or a history of stroke, speak with your doctor before changing your routine. Any sudden shortness of breath, chest pain, or rapid heartbeat needs emergency care immediately. Symptom 5. Swelling of gallbladder or liver. If you're over 60 and notice a strange fullness or tightness in your upper right abdomen, don't ignore it. While it might feel like mild bloating, it could actually be a sign that your gallbladder or liver is swollen, often one of the earliest signs of pancreatic cancer. Johns Hopkins researchers have reported that bile duct blockages from pancreatic tumors often cause visible organ swelling, especially in the gallbladder. This happens when bile cannot drain properly, leading to fluid buildup and pressure. Over time, the liver may also swell due to backup and inflammation even before pain appears. Imaging tools like ultrasounds often reveal this before symptoms become severe. To monitor, gently press under your right rib cage. If you feel a firm mass or unusual tightness, especially after eating fatty meals, record the sensation and note the time. Avoid greasy foods, which increase bile production and may worsen pressure. Try eating smaller, low-fat meals throughout the day. Add hydrating options like cucumber melon or broth-based soups to reduce bile density and support detoxification. Claire, a 73-year-old retiree, mentioned her belly felt fuller than usual during her annual checkup. Her doctor ordered an ultrasound, which revealed an enlarged gallbladder. Further tests confirmed an early-stage tumor blocking the bile duct. Treatment started immediately and successfully. If you've had gallstones, hepatitis, or liver disease in the past, consult your doctor before making dietary changes. Seek immediate care if you notice yellowing skin, dark urine, or sudden sharp pain in the upper abdomen. Symptom 6. Gas or bloating. For seniors, feeling full after just a few bites might seem like a harmless sign of aging. But frequent bloating or gas, especially when meals used to feel normal, could be an early red flag for pancreatic cancer. Many older adults ignore this subtle change, delaying diagnosis. A Mayo Clinic review found that persistent abdominal bloating was present in 29% of pancreatic cancer patients within 4 months before diagnosis. Tumors near the pancreas press against nearby digestive organs, reducing space in the stomach and slowing digestion. As a result, gas builds up, leading to prolonged bloating, tightness, or discomfort, even when eating light meals. To track this, keep a fullness journal for 5 to 7 days. Write down what you eat, how quickly fullness sets in, and how long bloating lasts. Switch to softer, easier-to-digest foods like oatmeal, bananas, and steamed squash. Avoid carbonated drinks, beans, and cruciferous vegetables during this test phase. Try gentle abdominal massages or slow walks after meals to encourage digestion. Henry, a 76-year-old widower, began skipping dinner after noticing constant bloating. His daughter helped him log meals and symptoms. A gastroenterologist ordered a scan that revealed a tumor pressing against his small intestine. Catching it early meant surgery was possible and successful. If you already have irritable bowel syndrome, diverticulitis, or food intolerances, consult your doctor before changing your diet. If bloating is accompanied by unintentional weight loss, vomiting, or pain, don't wait, seek medical help promptly. Symptom 7. Tummy or back pain. Occasional stomach aches are common with age. But if you're over 60 and feel a dull pain in your upper abdomen or back that keeps returning, especially after meals or while lying down, it may be more than just indigestion. According to Stanford Health, patients with pancreatic tumors in the body or tail of the pancreas often report radiating pain in the mid-back. This happens when the tumor presses on nearby nerves or organs. The pain may start mildly, then grow into a persistent ache that feels like it's coming from deep within your body. It often worsens after eating or when reclining. To monitor this, note when pain begins before, during, or after meals and how long it lasts. If lying down increases discomfort, try sleeping in a reclined or propped-up position. Use a heating pad for temporary relief, but if pain continues for more than a week, ask your doctor about getting a CT scan or abdominal MRI. Esther, a 69-year-old former teacher, started feeling a strange band of pressure across her mid-back every evening. Thinking it was posture-related, she tried stretching. When it didn't improve, her doctor ordered imaging. They found a tumor in the body of the pancreas, still in an early stage. If you've had ulcers, gallstones, or back issues before, don't self-diagnose. Seek medical advice before taking pain medications. Sudden sharp abdominal pain that doesn't go away should be treated as urgent. Symptom 8. Dark yellow or brown pee. Your urine color can reveal a lot about your health, especially if you're over 60. If your pee suddenly turns dark, yellow, brown, or tea-colored, and hydration isn't the issue, it could be an early warning sign of pancreatic cancer. The American Liver Foundation notes that pancreatic tumors often block the bile duct, which prevents bilirubin from exiting the body properly. This buildup forces excess bilirubin into the bloodstream and urine, darkening its color even in well-hydrated individuals. This symptom can appear weeks before jaundice shows in the skin or eyes. To monitor, check your urine color once in the morning and again in the evening for 3 to 5 days. If it remains darker than usual, despite drinking at least 8 cups of water daily, track it in a notebook. Avoid high-dose vitamin B supplements and beets, which may alter urine color temporarily. Focus on liver-supportive foods like leafy greens, lemons, and plenty of water. Linda, a 71-year-old retired librarian, noticed her urine looked unusually dark for several days. She wasn't taking new medications and stayed hydrated. Her doctor ordered a scan that revealed a small mass near her bile duct. Thanks to her early attention, she avoided more severe symptoms and began treatment immediately. If you have a history of liver disease, hepatitis, or take medications that affect the liver, consult your doctor before making dietary changes. If dark urine is accompanied by yellowing eyes, clay-colored stools, or itching, seek medical evaluation without delay. You've just learned 8 critical symptoms of pancreatic cancer, from digestive changes and fatigue to dark urine and back pain. While each may seem small on its own together, they create a powerful early warning system. Recognizing them could help you or a loved one detect the disease before it's too late, preserving strength, independence, and precious time. Start by choosing just one symptom that stood out to you today, maybe fatigue or bloating. Track it for the next 5 days in a simple notebook. Note when it appears how intense it feels and whether it improves with rest, food, or movement. If it continues or worsens, don't delay. Book a doctor's visit this week. Early action saves lives, especially for those over 60. If this video gave you clarity and confidence, subscribe now to get trusted weekly insights on senior health, natural prevention, and doctor-backed guidance before symptoms take over. Thank you for watching and for taking the time to protect your health. Your awareness today could help save someone's life tomorrow.